All right. Hi, everyone. I want to thank you for taking the time to join us today. Special thank you to the president of Rugby Texas, Maggie Rouse, and U.S. Youth and High School Rugby for organizing this webinar, as well as their continued commitment to the health and safety of their athletes. My name is Josh Beard. I am the AT Community Manager at Go4. For those of you who are unfamiliar with our platform or maybe a little bit new to it, what we do is we connect schools, teams, and sports organizations with per diem athletic trainers for events all across the country. Today, we have Nick Pfeifer speaking on sport-related concussion and what you need to know to help ensure proper recognition and management of these injuries. Nick is currently an athletic trainer and core residency faculty member at Boston University. His primary responsibilities include coordinating care for the Terriers women's soccer and men's rowing teams. Pfeifer has an area of clinical interest and specialty in neurotrauma and spine pathologies, with a particular passion for concussion rehabilitation. He collaborates with clinicians and officials across the university to provide a cohesive concussion management plan for the student body at large. Working alongside the residency faculty, Pfeifer provides mentorship and advanced skill development of all athletic training residents, with a primary role in the neurotrauma and spine track. Born and raised in the Garden State, Nick is a native of Rockaway, New Jersey. He is residency trained from Boston University's neurotrauma and spine athletic training residency. He earned a master's degree in health education from Boston University and a bachelor's degree in athletic training with a minor in health education from Kane University. Following Nick's presentation, there will be an opportunity for Q&A, so please feel free to type any questions in the comments section, and we will get to as many as time allows. Nick, thanks so much for being here with us today. I'll let you take it from here.
Awesome. Thanks so much, Josh, and thanks for everybody in attendance. I appreciate the opportunity to be here and talk to you guys about something that's obviously really passionate to me, and it sounds like there's some shared interest in your guys' organization as well. So in terms of some expectations in looking at my talk here tonight, what I really want to do is provide an opportunity to bring some awareness to things that you need to know about concussions and how some recognition on your part and preparation can help continue to put your athletes in great position to, continue to stay on the field. And if they do get injured, do the best to have a great model around them to protect both their short and long-term wellness and health. So at first, what I'd like to do is just, set a little bit of a tone here with what we're talking about. So obviously we're talking about concussions, and I like to define the problem at hand. So we're looking at a traumatic brain injury. It typically follows a force to the head or body and leads to a change in brain function. And concussions are typically not accompanied by loss of consciousness. Actually, in the literature, we see in the sports setting that only about 9 to 10% of the time do we see loss of consciousness. So I like to take this time to acknowledge that concussion is a traumatic brain injury. And we're all here today because this is an important topic, because it's an injury that's highly prevalent across our country and around the world. But also on the individual basis, we're dealing with a brain injury. And, as far as I know, we've not yet perfected the art of brain transplants. So this is something that's, of heightened importance to make sure that we manage this the best that we can. I certainly won't go into all of the complex neurophysiology about what happens when somebody sustains a concussion, but it is important to give a little bit of understanding to what's going on when somebody sustains this injury. So as you can see in the image on the right side of the screen, it does a good job interpreting what's going on when there is a concussion. So like I said in the previous slide, there's going to be a force to either the head or body. And what we know is that that head is going to be moving and the brain inside of the skull is going to be moving as well. What's important to note is that brain is really floating freely in a body of fluid inside of our skull. So there's no support structure or seatbelt, so to speak, inside that skull. So when we have that transmission of force, we know that that brain is going to move similarly to if you're driving in your car and you slam on your brakes really abruptly, you're going to continue moving while the car stops. The same type of concept happens here with the brain inside the skull. If we look at the image on the left, we're representing the different layers of tissue in the brain, and it's important just to highlight that with that force of that acceleration forward, and then the reciprocal acceleration in the opposite direction because of that start-stop, we're getting shearing of that brain tissue. Our brain is certainly solid, but a little gelatinous, so it's going to move kind of like Jello when we start and stop, and all the different layers of tissue are going to shear. It's going to cause a bunch of damage to all the small components that make up that structure, and that'll result in possibly some immediate signs and symptoms that we could see in our student athletes, but certainly some that could develop over time as some of that impact starts to manifest over time. I like to use this video to represent what I just explained. So you can see in that, in that little GIF right there, that brain is slamming kind of into the front of the skull there as that head comes to an abrupt stop there. And you can see what that recoil force looks like inside of that brain when you're moving like that. Now, this is just a straight ahead movement. And we know in sport, specifically in rugby, it's not a sport that's often played in just one direction. So you do have to consider what could happen if that athlete is rotating or moving their head or changing direction. We're going to introduce different vectors of force that could increase that shear, which could increase the trauma and the resultant damage that's going on to the tissue there in the brain. So like I said, concussions are caused by a blow to the head, the face, the neck, or anywhere else on the body. The main thing for us to think about here is it is a force that needs to result in acceleration and deceleration of the body. Our body's one unit, so if a force is delivered to our chest or our torso, like a violent tackle, our head's going to move in relationship to that as well. So although we don't, necessarily get hit in the head, we could still have that acceleration and deceleration going on inside of our brain because of a force that's somewhere else, transmitted somewhere else on our body. So that's something to be mindful of in everyone's role here, to not only be cued into hits directly to the head, but to understand that little nuance there that, if there is that acceleration, deceleration, that's going to be the real important thing there that could predispose an athlete to this injury. Think about those whiplash mechanisms. If somebody comes down and they, get hit on the body and they come down hard onto the ground, your head's going to recoil in response to that. So, being out on the lookout for tackles like that, obviously head-to-head contact is going to be very provocative and very risky, but also considering forceful tackles, perhaps of different sized opponents. If somebody a bit smaller finds their way into the middle of the pitch and gets tackled by a larger defender, that difference in mass certainly could increase the force in that tackle and definitely could predispose that athlete to a concussive injury. So that's going to be a big role for everybody on the sideline during a game, is to be cued into looking for these types of mechanisms of injury, as we commonly refer to them as. Athletic trainers on the sideline are great resources to be able to be a watchful eye and looking out for these things. But certainly there are many players on the field, and as many eyes as we can have looking for these types of injuries, the better chance we have to recognize a dangerous mechanism so that we can possibly get that athlete removed from play and evaluated further. Now, we might not see everything in terms of mechanisms of injury or risky movements or risky collisions. So what's important is to know what else we should be on the lookout for. Like I said, athletic trainers on the sideline are going to be a great resource as we're very trained to know what to look for in posturing and movement of athletes. But this is certainly something that could come into play for our coaches. You guys are very dialed in and familiar with the normal behaviors of your athletes and your team, and aware of what their deposition is during games and how they carry themselves and how they typically move about the field. So something that could be very important is highlighting or noticing when something just doesn't look right. And I have listed on the screen here a bunch of different signs of concussion that we commonly associate with how athletes will present after the injury. Um, but but like I said, our coaches know what normal is for their players. So if something looks abnormal, we can assume that something is abnormal, and we want to be able to get that athlete into a position where they could be evaluated and assessed for a concussion. So some things that I find very common in my practice as an athletic trainer is definitely going to be what the look on the student athlete's face is. And they often sometimes have a like kind of a glazed over or blank stare about them. They look confused, and they just don't move around with the same conviction that they normally would. Certainly, unsteadiness, wobbling, falling, losing balance, things that are uncharacteristic of normal athletes out on the field. Those are signs that we want to be cued into as well. And also, if that player just isn't retaining what their assignments are or what their roles are on the field, and are confusing where they should be, the very classic thing could be if the player's lining up on the wrong side of the field or is talking to the wrong players or something like that. Those are all signs that we could see that could give us an indicator that we need to get that player out and evaluate them for a head injury. When we have conversations with them, we're going to be able to dig a little bit deeper. So I have here on the right side of the screen a photo from a sideline assessment tool that athletic trainers commonly utilize on the sideline to diagnose concussions. And I put this on here just to show the very wide-reaching symptom profiles that we're on the lookout for as we're speaking with potentially concussed patients. So you'll see a bunch of symptoms that present either in mood or emotional dysregulation, in pain, whether it be headaches or pressure in head or neck pain, and then also visual disturbances with blurry vision or dizziness or um, sensitivity to light, perhaps sensitivity to noise, and then some other things like I referenced before about concentration or memory issues or confusion or balance problems. So these are things that we might listen for. In my role as an athletic trainer, I'm going to ask these specific questions to the student athlete that I'm evaluating. But perhaps we might hear chatter if a player is either, taken out of the game for some reason, whether they're substituted in rugby or other sports where there's more stoppages of play. Things that we can hear them maybe talking about with teammates, or even saying to you if a player comes up and reports that that they're having a headache or they're nauseous or they're just really having a hard time remembering what they need to do. Those are things that should set off an alert or caution in your mind that this is something that's abnormal, and we want to get them to a medical professional, and we don't want to put them back into a risky environment. So it's important to understand what symptoms and what signs are commonly associated with this injury. So when you see it, you know what to be cued in for, and you know what to be cautious about if you hear or see it, and make sure that you don't put that player back onto the field. I say all of this with a lot in mind. Obviously, we want to protect the health and safety of the player who's injured. That's at our utmost concern. And the phrase that's been coined is "when in doubt, hold them out," and it really rolls off the tongue. And it also is very impactful in the sense that we're dealing with a brain injury here, and we have a lot at stake. Um, so there are certainly other times with other injuries where it's courageous perhaps for players to play through injuries and tough it out and gut it out. And I caution all of you coaches in setting that culture as it relates to head injuries and concussions. There's a lot to be lost in gutting through and trying to tough out a brain injury. And like I joked about at the beginning of the talk, we don't have the ability currently in medicine to repair damage that's caused from these types of brain injuries, and the brain is the computer of the body. And if we have breakdown of that, we certainly are going to set our students or our athletes up for challenges later in life. Some things that I think are important to highlight are if a player is participating while they're concussed, there's a lot of risk that they're accepting, and they may not be in the best state to make a well-informed decision about if they are accepting that risk because they're cognitively impaired and their brain isn't functioning in the way that they can normally balance risk and reward and what implications of decisions are. There is a syndrome referred to as second impact syndrome. And to explain that to you is when the brain is concussed acutely, it's very unstable and the body is fighting very hard to try to regulate the normal function of the body, things that are involuntary to us, like controlling the circulation of our blood and controlling our breathing and our nervous system function. And when we have a concussion, all of these different systems are impaired, and our body's focusing very acutely on trying to preserve that normal function for life. Now, if we sustain another injury, and so while the brain is vulnerable like that, we risk swelling and bleeding of the brain, which could cause an emergent situation that could result in permanent brain damage or even in worse cases, death. And this is very serious. So that's the number one concern that we have as it relates to concussions happening during athletic play is eliminating as best as we can that risk for our athletes. Secondarily, things that might speak a little bit more to young athletes who may not be able to think about their long-term health when they're maybe 50, 60 years old. Some things that may speak their language a little bit more is that when the brain is concussed, we know that reaction time is decreased, coordination is reduced. So that will decrease athletic performance. Coordination and reaction time are integral functions for elite performance in athletics. So we know there's going to be a reduction in those. So we know that the performance is going to be worse. So that's going to affect the ability for the athlete to perform their best. And it's also going to affect their ability to perform their best for their team and their teammates. So there's a little bit of a shared responsibility there as well. Additionally, because of those factors, we've also seen in a lot of research that athletes have an increased risk of sustaining other injuries while they're concussed, and also when they come back from being concussed. So we have to think about that risk as well, that there's an increased risk for perhaps a significant time loss leg injury. So that's a big risk for the athlete's ability to continue participating as well. And then also, there's some more recent data that is confirming that those that participate while concussed and delay their reporting take longer to recover than those athletes that report their concussions immediately. So you have that risk as well, that if they take longer to come forward and report what they're experiencing and participate through the injury, it's going to take them more days to come back from the injury as well. So now they're going to miss more time than they needed to as well. So these are all important concepts for us to be able to understand and also explain to our athletes, explain to our patients, and explain to our student athletes so that they understand what's at risk here. And like I said, health and wellness is number one, and safety. And then also, those considerations around performance and responsibilities to their teammates and others around them. So these are all important things that we can reinforce to, have some shared language with our athletes. I like this visual up here because it provides a 30,000-foot view about what to expect when we look at a concussion recovery timeline. Now, baseline testing here on the left is the first step there. We use it extensively here at Boston University. We understand that there's not infrastructure everywhere for this to be a core component of a concussion management plan, but it's something we feel strongly about, because it provides an individualized reference when we are able to then look at a concussed athlete and understand what's normal for them as opposed to what's normal for their population or demographic. And the second bullet, obviously, is the injury itself. We know that it can come from a force transmitted to the head, body, face, or elsewhere, and it causes that rapid onset of short-lived impairments of neurological function. Then, when we look at recovery, we'll talk more about this in just a moment. But this is an important new development in modern management of concussions, where we're going to have a little bit of structured rest on the front end for a couple of days after the injury. And then we want to move forward with rehabilitation to help the patient actively recover from the injury, as opposed to just having them wait until they get better. And then we look at the last two bullet points that focus on returning to learn and returning to sport. An athlete should be fully returned to academics before they make their full return to athletics. It's very important. Learning, academic activity, cognitive activity, these are all fundamental functions of our brain. And then a common trend between, or a common concept between the return to learn and return to sport progression is that nice gradual manner that I'll outline towards the end of the talk here for you in just a few moments. But the main point there is that we want to do it in a gradual fashion to make sure that the body's able to handle each stage, they're ready for each stage, and there's not negative consequence from the new activity that we're going to introduce. So this is something that I always talk about with my patients when they are injured, because I want them to understand what we're embarking on and what the journey is going to be, and going from point of injury all the way back to their return to sport and class and academics. Now, this is a multifactorial injury. It's much more complex than, say, an ankle injury where the function of the ankle is very straightforward. Think about the brain, and like I said earlier, it is the computer of the body, so it has wide-reaching impact over many different functions, processes, and activities of the body. So it takes a team to manage this injury. Now, I have some different types of individuals who could be involved in this management and what some of their roles may be. I would like to take this time to highlight that athletic trainers are very well versed in managing these injuries. You'll see, 4 different types of care providers or types of individuals who could be involved. And I'll take this time to mention that athletic trainers are trained in emergency management, diagnosis, rehabilitation and treatment, and also return to activity for concussions and for all injuries. But specifically, we have advanced training in this realm of concussion. So our role in this process is very important, as we're well versed and also accessible. So we want to be able to have a care director, so that this injured athlete is not left to their own discretion to work their way through a complex recovery process. And an athletic trainer works underneath the supervision of a physician, and is able to help take the patient through all of these different parts of their recovery to make sure that they're getting the best care, the most informed care for their impairments, and really making sure that they get what they need. There are certainly specialists in both the diagnostic realm and rehabilitation realm. So different providers could be brought into the management of the case depending on how the athlete presents. So if they're really struggling with with cognitive activity and academics, we might incorporate a cognitive specialist or a speech language pathologist or a very specific type of rehabilitation specialist or physical therapist, if that's what this specific patient needs. And then looking at accommodations, these are going to be important as well. It's difficult for somebody coming back from a concussion or recovering from a concussion to be able to fulfill all of the daily responsibilities that they need to. Specifically, we're looking at academics. And working here at Boston University, we work really closely with our academic coordinators and professors and disability services so that we can structure a plan for each patient on how they can adjust what their academic responsibilities are so that they can manage things in reference to what their capacity is so that they don't try to do too much and make themselves take longer to recover or cause other responses or reactions in their injury process. So it's important to establish a lot of these relationships and build this healthcare team, you know, in anticipation of these injuries happening, so that there are people in place or contacts or networks of individuals that we have that we can use in the event that we have a patient or an athlete who has a concussion, because what we know in this country is it's a very common injury and it's going to happen. So we want to make sure that we have a plan in place to help manage it, to refer our athletes to. So through this lens, I would not expect our rugby coaches to manage this or be that care director, but I do think it would be a good idea to be able to have some contacts or references of individuals in your local area who you can help direct your athletes to in the event that they have this injury, so that they're not slipped through the cracks and they get care in the time that they need and to the degree that they need. Now, like I said, I don't expect y'all to be in charge of this process, but I do think it's important to understand what happens when we rehabilitate these injuries, and things that you can promote and advocate for when you see your athletes. Obviously, we're going to, from the medical perspective, really focus on active rehabilitation. The new literature has great support that if we are able to actively rehabilitate these injuries, those patients respond more favorably and have a shorter recovery time as compared to those patients that do not have an active recovery or that simply don't participate in any rehabilitation or any activity at all. So we want to promote and advocate for active rehabilitation because it's going to help address impairments, and it's going to help expedite the recovery process and address needs. Things that are important to also emphasize are things that can lead to an environment of healing that is positive. By that, I mean promoting normal functions that are setting each individual up for success. So adequate sleep is really important. Our body does a lot of recovery and healing while we're sleeping. And a lot of that recovery happens when we enter into our deep sleep. So it's really important that our athletes are getting full sleep cycles and chunks of sleep. Recommended is somewhere between 7 to 9 hours. And that's going to give the body the ability to focus on the recovery and move forward in that process. And also, our body needs the right fuel. So promoting appropriate hydration and nutrition is going to give the body what it needs to be able to recover. If there is not enough fuel in the body, it's going to have a difficult time executing that recovery process and doing what it needs to do. That physical and cognitive rest, we really want to take a few days on the front end right when injured to fully rest and allow the body to recover. And then we want to find that sweet spot in day-to-day activities and activities of daily life for the athlete that does not exacerbate their symptoms. We don't want to simply relegate them to a dark room for all of eternity until they get better, but we want to make sure that, if they are somebody that likes to go for walks through the city, if you live here in Boston, well, if we find that when our athlete goes for a walk in the city of Boston, all the busy roads and all the people on the road or on the sidewalks in pre-COVID world, all that activity around them actually makes them feel worse. Well, maybe we want to shy them away from that activity, but perhaps redirect them to go for a walk through a quiet neighborhood, perhaps, and find things that are not going to make them feel worse, but that are within their means. So that goes also to electronics. If they're a big, social media scroller and they find that the screen time is a problem for them symptomatically, then we want to curb that activity into a range that's not going to make them feel worse. And then lastly, what I think is really important in the athletic realm is the support system that it provides for all of our athletes, but specifically our athletes that are injured. This process is very traumatic, and we see athletes go through a grieving process as they're injured. And we know that there's a dysregulation to mood and emotional wellness when concussions occur. So having a robust support system around somebody who's experiencing a concussion is really important because it's going to provide them the support that they need, and also help to reduce some likelihood that they struggle more emotionally. So this is where the team dynamic is really important to make sure that the teammates and the coaching staff are supportive of the recovery process, and obviously others in the social circle around that athlete, because that support makes a difference, and it provides an environment that allows for efficient and effective recovery and healing. So I'm going to talk in this slide and the next slide about some progressive return strategies. First, we're going to talk a bit about return to school and what that looks like. And you'll see on the screen, I have 4 bullet points that highlight general considerations for an athlete returning from a concussion. Generally, like I was talking about just before, we want to progress in a way that the body can tolerate it, right? And it's the same way that as you're starting training for a new season, you want to build up that activity so that the players are able to understand what you're teaching them and apply new concepts and knowledge and skills, and also do it safely. Same concept applies here, where we want to make sure we give them a process so that they can go through it step by step, and we can make sure that when we introduce something that's a bit more challenging or demanding, that the athlete is ready for that and that their body can tolerate it. So you'll see here, first stage suggested is symptom limited activity. So that's what I was just talking about on the last slide. Those are activities of daily life that are not going to make their symptoms more prominent or worse or more progressive. So things that don't increase their symptoms, as long as they're not at risk to have another contact or collision, those things are all good. So, reading or being on the screens, or going for a walk, or playing with their dog, things that are going to be safe from an injury risk perspective and also safe from a symptom limited perspective is really our first stage there. So that's going to be, probably some homework or schoolwork at home in a controlled environment. Now, as we start to move into that next phase here, we're looking at those lighter school activities. So we can think about, integrating that classwork at home where maybe the environment is more controlled so that there's less of that stimulus around the athlete, the student athlete in this context, and they're able to focus just on the schoolwork, and they're able to control how much of it they're doing at a time, what they're doing when, and like I said, that stimulus around them. If they're able to tolerate, that activity at home, and you can work that in a, kind of like a work rest interval. Maybe they try some, reading for 30 minutes, and then they take a 10-minute break to rest. And then they work in that interval, and progressively that work interval lengthens and that rest interval shortens. Then we start looking at returning to school. And this is very individual based on the student athlete, but also the school, to understand what's available in terms of this accommodation. So increased breaks is something that I just described. So that kind of work rest interval is an option, but also maybe partial days is an option. Maybe the student athlete really struggles in the morning, and wakes up feeling their worst symptomatically. Well, that to me would tell me that morning class or morning schoolwork probably is not in the best interest here. So maybe we want to prioritize afternoon school, and maybe they don't come to school until after lunchtime and try to do the second half of the day. And then progressively we can start to lengthen that day until now we're back at return to school full time. And that's kind of that concept that we want to work with all of our resources in the school, in the household, and with the patient, to make sure that we individualize those accommodations so that they meet their needs. And then we look at that through the lens of athletics. The concept remains the same, but the environment is different, right? Now it's going to be in sport. Now, what I will say is the academics, in my professional opinion and the opinion of other professionals, is that the academics should be prioritized first. We need to return that full academic load before we start to reintroduce into this practice, this game activity, to make sure that the brain's ready for it. Now we have 6 stages in here, and this is the principle that we use all the way up here at Boston University as well. I will also highlight that each stage should represent its own day. So we're not going to do stages 1, 2, and 3 all in the same day. We're going to do stage 1 on Monday. And if Tuesday, now 24 hours later, stage 1 went well, now we're going to move to stage 2, and so on and so forth as we work down through stage 6. So you can see that this should take minimally a week for recovery. And on average, we see in the research that it's about a week and a half for that recovery process to occur. You'll see the titles for each stage here. That stage 1 is very similar to the return to school. It's that symptom limited activity. So we want to work and operate in a environment where we're not doing anything that's going to make them feel worse, but things that feel good are okay here. So as it pertains to athletics, if they have a stationary bike, for example, and that's tolerable, well, maybe they can look to start to get into that activity there. And as we look at stage 2, that's where that comes into play. So light aerobic activity is our goal for this stage. We want to be able to increase the heart rate and challenge the body in a more progressive way here now. So by either walking or stationary biking, we're going to increase the demands of the body, increase that circulation demand, and challenge the body with physical load. If that activity is tolerated without return of symptoms, then we can look to move on to more sport-specific activity. So in this example, looking at rugby, perhaps we can do some on-field running, and some running that would be in a multi-directional way that mimics things you would do during a rugby match. I will highlight there should be no head impacts during this phase, so that there's no risk there. And the goal here in phase 3 sport-specific activity is to change that heart rate load. So instead of just a nice steady aerobic load, we want to get that heart rate up, then we want to bring it down, and we want to get it back up again. So we start to mimic the demands of sport. Phase 4 starts to look at sport-specific drills here, so non-contact training. So perhaps being involved in some drilling, some passing and catching, maybe some non-contact, no tackling type training. Also, resistance training can be introduced here, so some weightlifting and things of that nature, because this is going to start to progress the activity to be more like sport. And then phase 5, we're looking at introducing contact. We need to know that the athlete is able to accept contact before we put them in an unrestricted and uncontrolled environment. So we want them to get tackled, and we want them to tackle somebody else, because we need to know, can the body tolerate that? Are they able to do it safely? And are they able to do it confidently? And are they able to do it right? If the answer to any of those questions is no, then we might not be ready for that stage yet, and we have to spend some more time getting the athlete ready and confident for that next step. If they're able to demonstrate competence there and they're able to satisfy our needs there, now we're ready to clear them for unrestricted participation. They should practice fully before they play in a game, however. Gameplay should not be phase 5. It should be the end stage there at 6. I will say that the precursor to starting the return to sport strategy is the athlete needs to be asymptomatic. They need to have all of their symptoms of injury resolved before we move forward to progressing them into gameplay, practice play, or sport activity. Now, like I said, each stage should take about or minimally 1 day. And if there is a return of symptoms at any point during this progression, they're going to need to stop activity until they return back to their asymptomatic or baseline state. And then they can resume activity under the direction of the medical professional at the stage prior to that resulted in those symptoms. So if at non-contact training drills in stage 4, they get done with that activity and they have a return of their headache, neck pain, etc. Well, we're going to wait for that to go away, and then we'll resume activity at stage 3 with sport-specific activity. If that goes well, then we'll reintroduce that stage 4 on the next day there. That way we expose progressive load. We make sure at each step that athlete is ready and able to tolerate it each step of the way. Now, there are a lot of things that we can all do to help keep our athletes safe and to help promote a culture of safety. If you look at the 4 markers I have on here, there's some considerations for different times of the year. I think that it's important, going into a season or going into having new players on the team to establish the culture of what the expectations are for that group. This is one of the most important thing that coaches can do to help benefit the health and wellness of our athletes and to help make our job as the medical professionals much easier. If there is a culture that prioritizes health, safety, and wellness, then it's going to be one that is safe and comfortable with being vulnerable with each other. And that's important because none of us here are mind readers, and we will all do our best to watch for the signs and listen for the symptoms and look for things that don't look right during the run of play. But ultimately, we need to be able to trust our athletes are going to be honest with us and that they're going to come forward and report to us when something's not right. And if they're not willing to do that, then we're not going to be in a position to protect their safety as well as we would be able to. So establishing a culture where concussion reporting is encouraged, promoted, and even celebrated is really important. And that goes for both the individual who's injured coming forward and reporting, but also for the teammates being on the lookout for their team. The same way that a teammate might be watching the back of their teammate out there for somebody who's on the opposing team is being too violent or taking cheap shots at them, and they're going to rush to their defense for them in that setting. This is no different. A teammate should feel the same impetus to rush to the defense of their teammate when they're injured or potentially concussed to protect their safety and their health, and also the team as well. So culture is going to set that expectation. Like we talked about earlier, being aware of what to look for, what to listen for, and what to recognize will put coaches in positions to see things that otherwise might have slipped through the cracks or would have gone unnoticed. So that's important so that you can direct them to a medical professional so they can get evaluated and assessed for concussion and be removed from play to help preserve their safety. And medical professionals, athletic trainers on the sideline, physicians on the sideline, they'll have the autonomy to remove that player from play. Coaches, you should also feel empowered that if you see a player that you have question about, that you can also remove them from play for evaluation as well. And also know that the officials are being trained in the same way to look for this as well, so they can do the same. So that way we have all of these eyes looking for this so that we can limit how many things might slip through the cracks. And then lastly, looking at recovery, that culture will extend through this process to be able to promote that culture of support, that positive environment, and promoting things that are going in the best interest of your athletes to recover, and also those around them to reinforce those things when they're in the home or in the classroom or on the field on the bench, something of that nature. So there's a lot that we look to coaches for to help us do this, and these are just a few examples. And as I said at the beginning, this matters because we only get one brain, and we are learning every year, every week, every month about what the impact is of this injury in the short term and also the long term. There's a great study that's being conducted here at the NCAA level between the NCAA and the Department of Defense that is looking at a big 10-year study of military cadets, student athletes at the collegiate level, and also non-athletes, so that we can collect 10 years worth of data so we can see in the short term what's happening, but also follow those kids long term to understand what's happening later in life. Because we're not sure exactly what happens long term from concussions. I will say that emerging literature is concerning. And I'm sure everybody has heard of, CTE or chronic traumatic encephalopathy. Here at Boston University, we have the leading researchers in the field who are studying this pathology. And what we are concerned about is that there is degeneration and injury to the brain that we're seeing from concussions, but also from repetitive head impacts or impacts to the head that don't result in concussion. So there is a lot of research that's looking at in the short term and the long term about what happens to the head when it's repeatedly impacted. What happens when somebody has multiple concussions? And what happens in the long term in the presence of those things that could be of concern, for that patient, for that athlete now, and then obviously later in life. We're worried about premature death, mental and emotional struggles, and degeneration of brain health and other bodily functions. And we're seeing correlation between concussions. So we want to make sure that we are prioritizing our approach to managing this injury, not just because the NFL says it's important and they're throwing a bunch of money at research for it, but because we know it's important, because we care about our student athletes, we care about our kids, we care about our patients, and we want to make sure that they can meet their goals now, but we also want to make sure that they're healthy now and later in life as well. So there are a lot of resources out there. I certainly would like to volunteer myself up as a resource to all y'all. I'll have my email and my phone number at the end of the talk. Then I welcome inquiries about questions or things of that nature moving forward. But also knowing what places to look for to be educated. The many of the rugby associations have great education, available online. There are formal trainings that can be completed through Heads Up. So those are great resources that are sport specific. Also, I'll speak on behalf of the NCAA and the Sports Science Institute. They have a great website with a lot of great information. There are handouts for coaches, handouts for students or athletes, handouts for professors and parents. So there's a lot of resources available to educate those around you, and obviously talks like this, and just looking for ways to help further your awareness, but also the awareness of those around you, so that we can make sure that we promote this type of approach in the things we control and also the environments of our peers and colleagues around us. Go4 is an amazing company that has a mission that resonates strongly with me about getting an athletic trainer on every sideline everywhere. That's important to me because, like I said earlier, athletic trainers are highly skilled medical professionals in the management of emergencies, diagnosis of injuries, rehabilitation of injuries, and ultimately return to sport and activity. So they are, the come between those athletic trainers and those people that need athletic trainers, coaches, sport organizations, other youth leagues and things of that nature. So they're a great company that will put people where they need to be and get all of you guys access to the medical professionals that are accessible and specialized for the needs that you have for your environment. And also the National Athletic Trainers Association, that's our national association. And they are a great resource to learn more about our profession and what we do and the skills that we have and where we're going as a profession and how we can better fit your needs. And I encourage all of you that if there are things that you hope to see in athletic trainers, or needs that you have, contact local athletic trainers or contact our district representatives or our leadership, and all of that's available online through our website, so that you can advocate for the needs of your community, so that we can focus the direction of our profession to better meet the needs of the community and those that we want to serve. So keep these resources in mind as you move forward, and know that you have me as a friend and as a colleague as we move forward together. On here, I have my contact information. I love this stuff. It's something that's really important to me, and I'm always happy to talk about it or direct you to resources, or just have a conversation about it. So feel free to drop me a line. I'm pretty available and accessible, and I look forward to that. I thank you for your time here today. All of you guys that are in attendance and watching this, and I thank Go4 for the opportunity for connecting me with you all. And I look forward to preserving the health and safety of our youth and keeping them on the field and doing things that they love and we love to see them. So thanks a lot for your time.
Nick, thanks so much. Great information. Really appreciate it. We did have a couple questions come in here during your presentation, and if anybody has any others, I believe Nick has the ability to unmute. We could work that technology out if we need to, but I know there's a couple typed in, so you can either type them in, or I believe you could raise your hand at the bottom, and we could leave it to Nick to figure out how to unmute it. But the first one, it looks like there isn't necessarily a standard protocol for a sideline assessment tool with high school and youth rugby. So in your mind, what does that kind of sideline assessment look like? Is there a tool that you generally use, or something that you would recommend?
Absolutely. So there's a lot to be considered in the assessment of a concussion. As I mentioned earlier, it involves many different systems. So our assessment needs to be multifaceted. The tool that I use and I advocate for is, the acronym is the SCAT-5. It's the Sideline Concussion and Assessment Tool. This is designed to be executed by medical professionals, but through their website, there is a version that's adaptable to coaches in terms of the things for you guys to be on the lookout for. So if you Google that, you're able to, or search through whatever web provider you use, you're able to find that on there. But from my perspective, what I look for is, using the SCAT-5, we want to assess cognitive function by looking at the ability to have appropriate awareness and responsiveness. We assess memory and concentration. We look at coordination. We look at balance. We look at reaction time, dynamic gait, and then also that symptom screen that you saw. That's an excerpt from that tool. So it's looking at a lot of different cognitive processes and how it controls other parts of the body. And we're also going to do some neurological screening to make sure that we evaluate for some other injuries that could be present in conjunction with concussion as well.
Okay. So now, do you think it's necessary to have an athletic trainer on the sideline at these rugby matches? Or if, let's say, there was a nurse available or a doctor available, I mean, is that a suitable substitute?
I would recommend first for an athletic trainer. I think that physicians and nurses, while they're also high-level medical professionals, athletic trainers have a specialized set of skills. So a lot of our focus in our education and our development is with athletics. So we're better equipped to understand some of the context and some of the contributions of the athletic setting. And also, like I mentioned, we have training in emergency management, diagnosis, rehabilitation, and return to sport. So we can really be involved in that full gamut of management of the case. So there's a nice continuity of care across the board. But also because of those specialized skills that we have, we're able to be, really available for anything that we would have to manage on the sideline. Obviously, other injuries included, but with concussions, if things were to be emergent, we can manage those emergent settings just as well as we could the non-emergent and conservative situations.
Okay, great. Now, let's say you're working with somebody that has a concussion, right? And they go to a physician and they get cleared for return, right? Now, once they're cleared, are you putting them right back into play, or is there something else that you want to do in the interim?
Yeah, so this is a great place for us to advocate for that return to sport strategy that I outlined. The physicians are in this example, are operating in a bit of a silo where they don't have that integration into what that sport activity is there, and they're not there to oversee that or to direct that, or to be involved in that, so to speak, in all cases. So the return of sport strategy is a great tool to be able to use to ensure that the athlete isn't going from, I was doing nothing on Monday, went to the doctor on Tuesday, got cleared, and now Wednesday I'm back in practice and I'm playing full. We want to make sure that we take that time, move them forward in that stepwise progression so that first and foremost, we can make sure that it's safe and their body can tolerate it in terms of the injury that they're coming back from. But also, secondly, depending on how long they were out, we want to make sure that they're able to take time to regain their athletic performance, their fitness, their strength, and their conditioning so that they can fulfill their role on the team and be safe from other injuries. And also to make sure that they're able to perform to the level that you expect as a coach or as a teammate or as an individual. And sometimes you need to take some more time to be able to retrain and reintegrate to gain that confidence. And one question that I always ask all of my soccer players before I put them back in the field is, are you ready to get hit in the head again? And sometimes they pause and look at me weird, but I ask that question on purpose because if the answer isn't yes, they're not ready to go back in.
Okay, great. Now, what are your thoughts on preseason baseline testing? Is this something that helps you with the return, or I mean, do you see that it might not be something that's as necessary now?
I think that baseline testing definitely has a role and has a place in the management of these injuries. I think that it is helpful to be able to have more information about the individual, but I don't think it's required. We can manage these injuries without baseline testing in a lot of the ways that I described about, responding to what the individual needs are and progressing in a stepwise fashion. The baseline testing gives us more information. So we have more data, so we better understand what normal is for that individual. So when we're going through that recovery process, we can reference where they are through recovery relative to what their normal is, as opposed to, maybe what normal is of their peers or those around them. So it's certainly helpful. I won't say that it's required, but for everybody, but it definitely can help give us more data and more information.
Okay. Do you commonly see any difference with some of the younger athletes? I know a lot of these rugby players are definitely younger than college age. They've got the 12-year-olds and the 14-year-olds. Do you see a difference in symptom presentation or length of recovery time or anything like that with these athletes?
Yeah, definitely. Depending on the age, it's a big consideration for us, and we expect longer recoveries for younger individuals. Um, this is a brain injury, and what we have to consider is what state is the brain in. Somebody my age, my brain's pretty close to fully developed, I'm hoping. But if we're talking about, a 12-year-old, for example, or 14-year-olds, they still have development of their brain to go. And, that's something to consider because their brain is not fully stable, fully established. So that could complicate their recovery. And we certainly want to take more time to make sure that that brain not only is able to function in the isolated setting, but is able to continue to develop the way that we expect based on the normal lifespan development for their age. So we see those recoveries as they get younger to be a bit longer. There is a youth version of the sideline concussion and assessment tool for those under the age of 12. And what it does is it helps make the questions a little bit more understandable for somebody younger, but it also has some questions for guardians or parents, as they often understand a lot about their child or their person that they're responsible for, that the child might not be able to articulate fully, because a lot of this is very hard to explain even for a college age kid.
Okay, great. Well, I believe that kind of concludes everything. I don't think there's any more questions. If anyone has any last minute, please get them in now. But if there aren't any more questions, this concludes today's webinar. Thanks again to Nick for sharing your knowledge, and to Maggie and US Youth and High School Rugby for putting all this together. If you do need help finding athletic trainers for your events, or if you want to set up a demo of our platform to kind of see what we're able to do, please visit go4ellis.com, and that's with a number 4. So it's go4ellis.com. Have a great night, everyone. Thank you so much for coming by, and stay safe. Thanks again.